first thing to know about me is that I am board certified in internal medicine and pediatrics. So I take care of both kids and adults with varying levels of complexity. Some people ask what internal medicine is, and one of the easier analogies is it's a pediatrician for adults. So if you have lots of chronic conditions, we help manage that. The second thing to know about me is that I am kind of special where I'm doing a hybrid position of hospitalist and clinic work. So every other week I'm in the hospital, every other week I'm in the clinic, which gives me really good exposure from acute ICU management to chronic care management and how to bridge those and continue continuity of care and help try to improve continuity of care. As a internal medicine pediatric doctor, or our name for the type of doctor we are is med-peds, we are qualified to see pediatrics. We're board certified just like any other pediatrician. So in clinic, we do all of the well child visits and everything like that, but we can also help take care of some chronic complex kids or chronic complex adults that have graduated from their pediatrician and are in more of the adulthood stage, because as a med-peds doctor, we've taken care of the complex kids, and so now we're more apt to be able to care for the complex adults. The relationship between their doctor and patient is very important, and it is one of those things that you have to have implicit trust in who's taking care of you. If you don't have that trust, then you won't feel comfortable bringing up issues or bringing up things that are worrying you. And having that relationship really can help further your health, because again, you can try to catch things before they progress. So the most rewarding part of my job is getting to know my patients as people. So everyone has a story that makes them who they are, and knowing that story really helps me take care of them and, like I said, get to know them as people. I think that my patients would say that I am a good listener and a good healthcare educator. I really try to take the time to go through why I'm doing the things that I'm doing in our appointment. So my favorite part of being a doctor is, again, educating the patient on their health. So going through why we are looking at a certain disease. Why is it important to either take the medicine that we're prescribing, do the lifestyle change that we're talking about, or proceed with the surgical intervention that we're referring them to surgery or whatever specialist for, and why it's important. What is the outcome that we're looking for, so that people actually know what is happening and trying to demystify what healthcare is. Procedures that I do here in the clinic include some cryotherapy for some skin conditions. I do knee and shoulder injections, some trochanteric bursitis injections of the hip. Some of the deeper hip injections I don't do, that I leave for ortho. And then incision and drainage type of things of abscesses. Now, if it's around the face or anything like that, I typically will refer that out. So when I am not working, I like to spend time with my family and friends, and that includes doing nothing at all versus a bonfire versus cooking for them, or even going to locally owned restaurants. That's usually one of my favorite things to do. So.